Good afternoon, everybody. Is this on? Yes? Great. Well, really pleased to be here. Can't hear? Oh, there we go. As announced, I'm Gregg, Alton, the Executive Vice President of Gilead Sciences, and I'm here with...
My name is Tori Cooper. I'm an HIV health educator at Positive Impact Health Centers in Atlanta, Georgia.
Why don't we get started?
Wonderful. So, Gregg, there have been a lot of advances in HIV treatment and diagnosis since the 1980s. So it can be easy for a lot of people to think that HIV really isn't on the national conscience anymore. Statistics and data are showing, however, that especially in the South, that's just not the case. So tell us a little bit about what Gilead is doing to the most impacted communities, LGBTQ communities, transgender women, particularly those of color, MSM, gay men, bisexual men.
So let me start on the first statement in terms of the advance in HIV/AIDS since the 80s. I'm from San Francisco, born and raised in California. Been at Gilead for about 20 years now, so we've seen tremendous progress, whether it's in San Francisco, whether it's in sub-Saharan Africa, huge amount of progress. And for example, in San Francisco, as most of you are aware, over the last 10 years, we've seen an approximately 60% reduction in new infections for HIV. And that's driven by treatment as prevention, a lot of outreach, a lot of support services, PrEP, and other prevention. So it's been great to see. But as you point out, we have not seen the same progress in the South. The South still is too far behind. We have about 50% of new infections, 50% of the prevalence of HIV, and 50% of AIDS deaths in the South, despite being about a third of the US population. So there's clearly a problem there. And it's even worse if you look among the either black women, black gay and bisexual men, and the transgender community of the South. So we see the problem, and we've seen these statistics, and you ask the question, well, what to do about that? And that's a very good question. And we have some ideas.
So what do you think is driving some of the current trends?
Well, clearly, one of the things that we see, and we spent a lot of time talking with the groups in the South, stigma and discrimination, homophobia continues to be a big driver, we believe, of the challenges, but it goes beyond that. It's really complex. You've got just basic inequalities, you've got racism, you've got poverty. We have laws in the South that are discouraging for people.
Archaic as well.
Well, archaic as well, and so there's a lot of attitudes that are a problem in the South, and so I think a lot of people who are either at risk of having HIV simply don't feel the support or the love or the services available to them.
Thank you. And you mentioned the word stigma. Tell us a little bit more how you feel this stigma is really affecting the epidemic.
So, I was in, what clinic was that? I was in Birmingham, actually, not too long ago, and we were meeting with a great group. I think the name is Magic City in Birmingham. And we see the type of work that they're doing to reach out to the LGBTQ community, and the stories they tell us about people, young gay men or young gay boys who are afraid to say that they're at risk, to seek out prevention or PrEP services, or maybe not even aware of them, but because they know that they could be kicked out of their houses. They could become homeless very, very quickly. And what we see with this group is they provide a safe, comfortable, loving environment where people can go, they can be with people and cared for by people that not just look like them, but are like them and come from their same background. And it makes a huge, huge difference.
That's amazing. So would you say that stigma is one of the issues that's driving the epidemic, particularly in the trans community? And I generally say trans communities, because there are a number of different trans communities. And so yes, tell us a little bit about that.
No, I do. I think stigma is I mean, if you look at, trying to contrast, say, San Francisco, as I mentioned earlier, in the South, and I don't want to compare the two because there's a lot of differences, but, as I often say from San Francisco, we love gay people in San Francisco. It's totally normal. My kids go to school with, children of same-sex couples. They don't know any different. They don't think anything of it. And you contrast that to, what we see in the South, and it's completely different. And so just, imagine the difference of being in a community where you feel you can be completely out, you're completely accepted, versus being in one where there's heavy discrimination, there's heavy stigma. Are you really going to feel comfortable going into the health system and saying, I'm gay, I'm at risk, or I'm transgender, and wanting to receive those services? It has a big impact.
So this isn't a question on our paper, but do you think that there's a lack of perceived risk within some of those communities?
Yes, I think there's either a lack of perceived risk or just a lack of understanding what the actual risk is and what's available. I think there also is, I personally believe that a lot of people just don't see that there are people out there that care about them. I think there's people that simply say, I am not liked, I'm not accepted by my community, and therefore there's almost a, not giving up, but just not seeking out the help that they could get.
Thank you for that. So tell us some other things that are working, particularly in LGBTQ community.
So what we see, and I spend a lot of my time dealing with barriers to access or barriers to care, is organizations in the community that are passionate about caring for people who are LGBTQ. You need those organizations are the ones that make the big difference. And what I can say is those organizations do exist in the South, and what they're missing are resources.
So I work a lot, mostly with transgender folk and transgender communities, and I keep saying that word because it needs to be said, particularly when we're talking about HIV and AIDS. So tell me some specific things that Gilead is doing.
So, we just announced our Compass initiative yesterday, or actually the day before. I'm losing track of time. It's been a whirlwind. But, this is an initiative that really came from a visit to the South. So I mentioned I was at Magic City. I also was at AIDS Alabama, and a bunch of Crescent City and others. And what we saw was, groups that are just passionate, dedicated, capable, just and doing an amazing amount of work with very, very limited budgets. And Doug Brooks and I don't know if you know Korab, I think. Yeah, of course you know Korab. We were out with June and her team, and we're just like we got to do something. We have to because Gilead, we have resources and we can do stuff. And these are organizations that we don't need to create something new. We just need to invest in what's already here. And so we came back, and Doug and the team kind of came to me a couple weeks later and said, Greg, you said you want to do something, right? I said, well, we have an idea. And what we need to do is we need to invest in these organizations. And they proposed we do $100 million over 10 years. To invest in the South. I'm like, well, I'm totally supportive. Let's see what we can do. And we're able to push that through. And so what we're going to do with this Compass initiative, we're going to support 3 coordinating centers, because we really want this to be about the South taking care of the South. So we don't want to be the ones choosing which groups we're going to work with and what they should be doing. They know what to do. And so we're working with Emory University Rollins School of Public Health, who's going to be working on capacity building and knowledge sharing of these grassroots organizations. We are going to be working with the Southern AIDS Coalition. I think Nick is here somewhere. And they're going to be working on education, awareness, and stigma reduction. Again, supporting local groups in the South. And then finally, the University of Houston School of Social Work, who's going to be working on wellness, mental health issues, and the trauma associated with HIV, which I actually was able to meet with some of the patients that were being served by this group. And clearly, mental health and trauma are huge issues among the community, and we need to deal with that.
Yeah, historical trauma is a huge issue that I think often we neglect to talk about when it comes to HIV and AIDS.
Yeah.
So thank you. So who are you going to work with? You just told us that. And how are these agencies going to use their expertise to work directly with their community partners? Well,
I mean, so they know the community. So the people that we're working with, they know a lot of these organizations. So they will make the decision. This is not going to be Gilead making these decisions. So it's going to be Emory, it's going to be Southern AIDS Coalition, it's going to be University of Houston. And they're going to be working with groups on the ground that, again, have these great capabilities, great desire, and as they even say, we need more resources. We want to do more. We want to save more people's lives. We want to prevent more infections, because we're doing it now, but we want to do a lot more.
Sounds like some amazing things that Gilead is going to achieve with this initiative.
I'm really excited about this.
Thank you, Scott.
You're welcome.